of the Justice Collaborative and your host. And today we're discussing an old idea applied to new times. During the Great Depression, the New Deal created a works progress administration that paid people to take care of needed services and helped pull the economy out of disaster. Around 40 million Americans are unemployed today, and tens of millions more are facing unemployment. Nearly 100,000 Americans have died and millions more infected just 2 months after shutdowns commenced. As states begin to reopen, additional waves are expected. Although the United States has more than a third of total world cases, US testing is still lagging behind places like Italy, which has had almost double the number of tests per million people. Testing is increasing, but the full scale of the pandemic is not known. And experts estimate the country should be doing roughly 500,000 tests per day on the low end to nearly 1 million per day, according to Harvard's Global Health Institute. That is about 4 times as many tests per day as the country is doing right now. We also need to follow up when people test positive to see who might else have been affected. And without that testing or tracing, a second wave of COVID-19 coming in the fall could create a second wave of health-based and financial devastation. So right now, we are experiencing the worst economic crash since the Great Depression. Controlling the pandemic is critical to any kind of recovery. It is critical that we rapidly create well-resourced national responses that allow us to do the things like trace contacts of people with COVID-19 to determine who is at risk and to prevent further spread. Today, we are joined by Oregon Senator Jeff Merkley, Oregon's Multnomah County Chair, Deborah Kafoury, and 2 amazing public health experts, Dr. Gregg Gonsalves and Professor Amy Kapczynski of Yale, who have proposed a new take on a New Deal proven idea, a national community health corps that would provide critical services needed to recover from the pandemic, like contact tracing, which helps identify people who have the virus so they can receive access to treatment and prevent the virus from spreading further. So I'd like to start with you, Senator Merkley. You recently introduced legislation alongside Senator Elizabeth Warren and Tina Smith, as well as Representative Andy Levin, called the Coronavirus Containment Corps Act. This would provide $10 billion in funding for coronavirus contact tracers. Senator, what is the status of the national contact tracing, and how far are we from where we need to be to safely reopen?
Well, we're an incredible distance from where we need to be, because with every new case in America, we need to be able to track down the folks that they've been in contact with. And not only does this mean that we can work with people for them to self-quarantine and reduce the possibility of the disease spreading, but it greatly enhances our complete understanding of how the disease is spreading. So it gives us a foundation for how we can reopen the economy in a safe manner. So it's essential on both fronts. It is absolutely essential that we provide the support to enable the country to hire this massive corps of contact tracers, and that we do it now. We should have done it weeks ago.
Thank you, Senator. So how do we get there? How do we hire this massive corps of contact tracers? And specifically, will the Coronavirus Containment Corps Act be part of the next round of stimulus whenever it comes?
So there's the policy and there's the politics. The policy, the idea that this is an essential part of going forward, is shared by basically almost every health professional in the country. Understanding the absolute, this is the foundation. Testing and tracing are the foundation, TNT. The politics are more complicated. The funding would go out to community organizations throughout the country to hire, to our local governments to hire. It has, in addition to the 10 billion that you mentioned, another 500 million that is designed for hiring people who do not have perhaps the expertise to immediately play this role, but can be trained. And so the bill calls for a national plan to develop within 3 weeks, a detailed plan, the 10 billion for tracers, 500 million to help put people to work who have been out of work and challenged in finding appropriate additional way to re-enter the economy, and protect privacy. Those are the 4 main points. So over here in the Senate, you have a majority leader, and the Republican Party controls the Senate, where they're saying there's no urgency. And they're also saying, the majority leader has also said, and as far as the states and local government go, they can go bankrupt. That's their problem, the revenue. This is absolutely egregious point being taken by the leadership of the majority in the Senate. Well, local governments provide the foundations of healthcare, of housing, of education, of infrastructure, of public safety. And we cannot allow that infrastructure to collapse in the midst of this crisis. In fact, we need this partnership between federal funds and local abilities in order to go effectively forward.
Sorry, I was muted. So how do we help foster that partnership, right? Like, how do we make it clear that this is a priority nationally and that, senators need to pay attention and act with the urgency that you mentioned?
Yes, everything that happens is moved forward by advocates inside and advocates outside. So we need the healthcare community across the country, we need the local governments across the country weighing in with their senators, particularly when they have Republican senators saying this is urgent, that we are going to completely mess up if we reopen without testing and tracing in place. And we really need the knowledge on exactly how this disease is moving. And so the Senate shouldn't be out next week because they're scheduled to be out this coming week. They should be in, and they should be passing this bill along with massive support for state and local government for the fundamental services they already provide. So we need grassroots pressure to say this matters. Now we do have, I'll give you an example. We have governors, Republican and Democrat, working together saying we need this help. So if we can add to that lots of pressure from local officials and community groups, that will really be helpful in moving the dial here in the Senate.
Have there been any arguments that have been particularly persuasive from a bipartisan standpoint? Anything that has been said that you could tell like that's resonating with your colleagues?
Well, I think the most effective thing have been the governors, because when they speak with one voice across both parties, it reverberates here. And they're saying, help us, we're in trouble. The majority leader has referred to helping state governments. He's put it in partisan terms. A blue state bailout, I think were his exact words. And that's just absurd. I mean, we're Americans together in this. This is the last moment that we need this kind of, well, does a little more money go to more populous states because they have more people, and are those states tend to be blue states? No, we're all in this together. And so, in fact, for example, it's rural hospitals and healthcare clinics that have seen the biggest stress on their finances. And we want to make sure that rural infrastructure stays completely in place. We're all in it together. So the governors have been effective. It has led to the question of, is the majority leader really serious about this, let the states go bankrupt? Is he really serious, that doesn't think testing and tracing is important? And I think the answer is no, not completely. Part of what he's doing is laying down, well, we'll have the other side ask for that essential thing as a bargaining strategy to get some things we want. At least I'm hoping in a way that that's the case, because we have got to help out state and local government.
I hope that's the case too. Just for our viewers, can you please review the key points of the legislations for when they start calling their senators?
Absolutely. First, a national plan for contact tracing for this. And second, so you want to have a plan to do it effectively, including we put in a distribution formula so the funds can move quickly, but how it's going to be used, guided. The funding to create this coronavirus containment court, hire 100,000 people. Third, 500 million to help people who really need help getting back to work, back into the economy. And finally, a strong emphasis on privacy.
Can you talk a little bit about the privacy? We're going to get back to it later, but just what's the privacy concern briefly?
Well, it keeps coming up in the context of people hearing that their information from their cell phones is going to be collected in some massive database and shared with the world to track down everywhere they've been and who they've been around. And they're appropriately, in my mind, freaked out that there is a massive government and private company conspiracy to spy on them at every second of their life. So that's the concern. So we really wanted to emphasize that in this strategy of coronavirus containment core, there is a respectful strategy based on what we've done in the past of working with people and working in partnership with them in terms of who they've been around. We're not employing some technology to spy on people and create a massive database. That's been a key worry of folks.
Yeah, I've been hearing a lot of that too, and we'll definitely get back to that because I know some of our other panelists want to weigh in. So I'd like to bring in, thank you so much, Senator. I'd like to bring in Gregg and Amy. Can you guys please tell us a little bit about your vision for reimagining the New Deal's Works Progress Administration as a community health core, and what jobs and services it could create on a national scale or a local scale? Gregg, you can go first.
Sure, thanks for having us. So Amy and I put forth this idea in an article called The New Politics of Care in the Boston Review, so people can read it at their leisure by going to the Boston Review's website. But contact tracing, testing, contact tracing and isolation is only one part of what we need, right? Communities need a lot more than this to make it work. We need a whole sort of range of social and economic support, whether it's food, childcare, dealing with evictions, potentials from landlords, dealing with domestic violence concerns. So we're going to need a whole range of services to accompany any test, trace, and isolate program to address long-standing health disparities and crises of trust in the communities hardest hit by COVID-19. We're trying to build better health from the bottom up, not just come in and say we're here to deal with one virus and say goodbye, right? So we want to create something over the long term, and it's going to need people who do basic things like contact tracing and helping people move into isolation if they're positive. But it also has elements of social work and legal support and advocacy for families and communities around the country. And I'll let Amy sort of fill in the gaps there.
So I think the idea of starting, am I muted? Can you hear me now?
No.
Oh.
Yeah, you're great.
You can hear me now. Sorry, I think it's the internet. So I think starting with contact tracing and testing is critical, and we absolutely need a huge surge of money and capacity to do that. But we do need to imagine then what happens when these contact tracers are reaching out to people who, themselves are really not in a position to follow the public health advice without some support, because they have conflict with their landlords, because they have health insurance problems, right? Because who's going to feed their kids, right? And so we see it as really important to build in an infrastructure of care along with the contact tracing. And that's for a couple of reasons. One, we want to be effective. We want people to be able to follow public health advice, right? And that requires support. Two, we want people to rebuild a sense of trust in government, right? So if the person who comes to you and says, you got to stay home for 14 days, but I got nothing for you. I got no hand sanitizer, I got no masks, and I'm sorry you're having trouble with your health insurance, but I can't help. Like that's not the picture I think that we want people to have of what happens when the government comes to your door, right? You want somebody to be able to get support. And we do want some of these jobs to stick around, because I think one of the things we've seen, I grew up in a rural area, the decimation of some communities who really need health services and who need support services over the long term. Think about the difficulty people had accessing unemployment insurance. That we need support structures to start getting government to work again for people in rural areas and urban areas. And the virus is highlighting a lot of the communities hardest hit and who need the most support over the long run. So start this way, but think about it as also a jobs program, that in a moment with tens of millions of Americans out of work, we can start figuring out how to put people back to work to make our communities healthier again.
Thank you, Amy. And thank you for connecting the dots. On the briefing, we've been discussing over the last month all of the trauma and everything that vulnerable communities are experiencing, and that's from healthcare to the economics to housing, right? So thank you for connecting all of that. With respect to this legislation, other than what you've already mentioned, is how does the legislation compare to your vision for the future, and what more do we need to build on top of that legislation if we get it passed?
I mean, I can jump
Gregg,
in.
you want to take
I
that?
think,
And Amy or Greg, you can take it.
sure. So I guess politics is the art of the possible, but this is probably not ambitious enough for what we need. And if Mitch McConnell's going to cut back on anything Senator Merkley and Senator Warren and the rest of our senators propose, it'd be nice to see more upfront built into the bill, so that as we cut away what we get in the final bill, we end up with more left on the table. But I think there's a broader set of activities that Amy sort of indicated need to be invested in any sort of, we're not calling it a contact tracing core, we're calling it a community health core, or a core for community health, because that's what we're talking about. The reason we have COVID decimating African-American and Latino communities, rural communities in the United States, isn't because this is a particularly destructive virus. It's because we've underinvested in public health across the country for many, many years. And if you look at a map with health disparities in the United States, it's the same map that COVID-19 is striking right now. So we need to aim bigger and build better health for the rest of the century, and it has to start now. This is the best opportunity we'll ever get.
Senator, I want to give you an opportunity to respond to Greg and Amy. We're thinking about big vision for healthcare. How does this relate to going forward the overall vision that you have?
Yes, it's very complementary. In Oregon, we really helped pioneer the idea of comprehensive Medicaid, with the idea that maybe when somebody leaves the hospital, somebody should follow up with them and see what they need and see if they can get the prescriptions. And if the temperature in their house is 103, well, they need an air conditioner in the window. How do we help make sure that's there? And I think it's very similar in this case. Federally, we're attacking many of these issues that Gregg raised. For example, on food, I've been championing the 15% increase in food stamps, and known now as the SNAP program, and a strategy of providing federal supplies to boost our food banks, a whole series of pieces on that. There's pieces of the bill, in the broader bill, it's known as the HEROES bill that the House has passed, addressing childcare. I've championed the ban on evictions and foreclosures, and the cutoff of utilities, which is very important. But the idea that someone who comes to your house as a contact tracer can also help ask the question, what else are you going through, and has links to be able to assist, be it issues that are raised about transportation, about food, about anxiety over PPE, personal protective equipment that is needed. Persons want to know family members, how are they at risk? I have in my house, my mother has moved in with us. She's 93 and high risk congestive heart failure. That creates an additional anxiety in our home about the So that's a great idea. The basic thought that we have nationally is that if we can fund this as coronavirus containment core, there'll be a lot of flexibility on how states use this money and complement it, the training with additional ability to connect people with social services. But we also feel the states need that other money that we're talking about that is in that HEROES House bill, $500 billion to the state government, $375 billion to the local government, another $20 billion to tribes and $20 billion to territories. So that will be additional money separate from this core that the state and local government can use to accentuate the capabilities of those individuals who are doing the contact tracing. So in the end, I feel like they're pretty parallel thinking involved.
Thank you. Chair Kafoury, Deborah. So we've talked about federal, we've talked about big picture public health. What's happening on the ground? Can you please describe, what's happening on the county level and what this means to you?
Well, thank you for having me today. So I grew up here in Portland, actually not far from Senator Merkley. And I can tell you that we have never seen this kind of disruption. So far, we've lost 145 Oregonians and thousands of people have gotten sick. 1 in 5 Oregonians have lost their jobs. So Multnomah County, the government that I lead, is leading both the public health response tracking this disease, and we're responsible for the safety net response of housing and feeding the most vulnerable in our community. So this is unprecedented for local government. While we have flattened the curve here in Oregon, we're very happy about that. People are scared, and they're scared to reopen. There's no vaccine, no cure, and not enough testing. But one tool that we do have is contact tracing, and we have to do this right because of our density and our demographics. In Multnomah County, we have the most people, we have the most hospitals, and the most long-term care facilities. We have the most people experiencing homelessness and the most diversity. So our contact tracing has to be really effective. Since the first case in Oregon on February 28th, Multnomah County has gone from 7 contact tracers to 45, and we still have to more than double that number before we can reopen. And here's why that is challenging. Contact tracing isn't telemarketing. The person affected has to trust you enough to tell you everywhere they've been and everyone that they have been with. And this is a challenge, as 1 in 5 of our residents speaks a language other than English at home. So we need multilingual contact tracers to work with people from different backgrounds and help them understand. We've talked a lot today about privacy. We have to help them understand what's going to happen with this personal information, which is completely confidential. And then when people test positive, we have to figure out how to quarantine them so they don't get everyone in their household or their workplace ill. So in Multnomah County, we built a team model to do this. And that team has contact tracers and a health worker or a navigator from a local community organization. That person's job is to help deal with the workplace, deal with the boss, help get that family food, masks, gloves, whatever they need to keep others in their household safe. And we believe that this wraparound approach will help people to do the right thing and quarantine. Building that right team with the right mix of skills takes time, and we're not there yet. And we need help to pay for it.
What kind of help do you need? How would a health corps, help what you're doing on the ground and help those teams?
Well, the health corps would be extremely, extremely helpful. So far, this pandemic has pushed us into a financial crisis. Multnomah County has 20% of Oregon's population. We have 40% of the deaths from COVID and 100% of the public health response. But we received less than 2% of the federal CARES Act funding allotted to Oregon. So we're in a crisis. Local communities don't have the support they need. So I believe that now is the time to imagine what a national response could look like, because the current one is just not working.
Do you have any best practices? I know some of our viewers are in other counties and cities around the country. Any best practices you could share with them from these teams that are on the ground?
Well, we believe that having this team approach, so it's not just one individual going out and trying to contact people, it's having somebody from the community that is represented. So you have somebody potentially that you know, or someone who your community tells you speaks your language, has your cultural background, and then moves quickly. We really want to make sure that we can help the person who's been affected, we can help their family. And as we've talked about today, we're trying to make up for health disparities that go back decades and generations. So these families were in crisis prior to this pandemic, and this issue has only exacerbated the troubles that they're going through. So they need childcare, they need food, they need help paying their rent. And that is really what we believe is what's going to get us through.
Awesome. Thanks so much, Deborah. Before expanding the conversation, I'd like to bring in some polling. So a polling report from the Justice Collaborative and Data for Progress found 9 in 10 voters, 9 in 10, support creating a health-based response corps that could provide pandemic support. So my question for all of you, starting with you, Senator, is if public support, public health experts, and leading economists all want and agree that a community health corps for contact tracing and other support would be a great deal, what is stopping Congress or local cities and states from creating these systems?
Well, it is just outrageous that Congress hasn't created it yet. I mean, the House came very close with their massive support with state and local government that could be used to fund this, although it wasn't designated specifically on the tracing side. It was more like bundled testing and tracing support and other services. But the Senate really is the problem. The Senate has changed so that you cannot move a bill to the floor without the majority leader. You cannot put an amendment on the floor without the majority leader. It's the exact opposite of what was envisioned with 100 members having roughly equal power. And so one of the things that I'm fighting for in the Senate is completely reform this place, because we're not responding quickly and adequately to the fundamental issues Americans faces. And this is a moment that paints that in such dramatic, bold ways of our failure to move as quickly and boldly as needed. So I'm hoping that this coming week, where the majority leader has shut down the Senate, senators will go home. They will hopefully hear a lot about what the hell is going on with the Senate, why aren't you acting, and come back with a whole new readiness to move forward a week from Monday.
I hope that's true.
I hope so.
Praying for that every day. Who else wants to jump in? What else needs to be done? Go ahead, Gregg.
So I'm going to put on my AIDS activist hat and say there's bipartisan support for all of this. Senator Frist, former Senator Frist, Mark McClellan, and Scott Gottlieb, former FDA commissioners on the Republican side. There's a small group of senators who are blocking this, and we have to burn up the phone lines, burn up the emails, burn up the socially distanced visits to your local officials' offices, because they need to hear from us all over the country. They're not going to move and move for us unless they have to. And they might do it kicking and screaming, but we got to act up and make them do what they need to do.
Gregg, thank you for mentioning your work during the AIDS epidemic. Can you share with all of us just some lessons learned from that experience, right? Because I think that's a very, very valuable experience that we could hopefully not make some of the same mistakes that we made back then.
The point is as Senator Merkley and others have said, is that you need to make your government do the right thing. And in the AIDS epidemic, we botched the response to an infectious disease and let tens of thousands of people across the US get infected with HIV. We're doing the same thing now, 30, 40 years later, and history is repeating itself. And we have a choice right now because we're in the middle of it. Affected communities really changed the shape of the epidemic. It wasn't the CDC or the NIH or the federal government that responded early on, it was communities. So from Oregon to Florida to New York to Massachusetts, people acted up and really forced their elected representatives from local, state, and federal levels to do the right thing. So again, people need to get on the phone to their senators today, tomorrow, all weekend, all next week until they pass this bill.
I'll just add to that, and I think one of the things that health advocates have been saying for a while is that, health is not it's not natural, right? I mean, we're responsible for the fate of this pandemic, for which direction it takes. And so what we really need to do is get out there and hold the government accountable for a structure and a response that really will save people's lives. So we need to get out there and put that kind of pressure on people, because there are good proposals out there that will make every bit of difference. And I think there's a little bit of a dangerous narrative that's emerging now that either there's nothing we can do or don't worry about it because only some communities are affected and it's not really going to hurt some parts of the country and we can just reopen, as if it's the government that's the problem and not the pandemic and our inability to organize a response that really protects people, right? So I think there's a bit of that complacency that's emerged that really is going to change. I think it's going to change because I think we're going to see, if we don't get our act together really quickly, we're going to see a rebound, and we're going to people are going to start to see that this is not just affecting some communities, but it's going to affect all of our communities.
Thank you, Amy. Deborah, what's persuasive for you and your colleagues? I mean, you're already doing the work, when you talk to your colleagues and other local officials around the country, specifically, especially given that if we're doing it right, we're social distancing, what are effective organizing strategies in this time? Whether that's picking up the phone call, Twitter storms, emails, all of the above. Can you review some of that?
I think all of those tactics that you mentioned are the right ones. And I think just sharing your personal stories, I mean, this crisis in Congress is happening, but it's playing out in Portland, in Bend, and in Brooklyn. And we're paying the price with people's lives. So we need Congress to act. And I think sending that message directly to your representatives, your senators, is what we need to do.
Awesome. So, my friends in Silicon Valley and folks, you guys have mentioned this before, they're saying we have all this great technology. Technology is going to solve all of our problems. And I'd like each of you to address why that's not the case, including the role that technology can and will play, but how we need to combine technology with respect for privacy concerns and people in the community. Each of you have touched on it in different ways, but I'd like you to just kind of summarize that for everybody. Senator, you're good.
There's basically two strategies that have been worked on in terms of how apps or technology, automatic tracing that happens through our telephones, our cell phones can work. One is a centralized system where all that information on your phone, where you've been, how long you've been there, is all basically channeled to a central database. That central database can see who's been in contact with whom, and then when somebody becomes positive, it can be tapped into and can determine who and how long. So that's the centralized version. Then there's a decentralized version where you put an app on your phone and I put it on my phone, and we voluntarily decide we want to participate in this process. And then if I become positive, by using this app, we both agreed that my app can look out and see, going back several weeks, who have I been around, who also has the app on their phone, how long, and so forth. So it's one is voluntary. That's the way that Google and Apple are pursuing it. You opt in. The problem with that is it just is not a comprehensive strategy. Many of us will choose not to opt in. The centralized system is just a massive spying operation that offends people in all kinds of ways. And it feeds into lots of concerns about both government and industry monitoring our every movement. And is that the type of world we want to live in? So there'll be a lot of opposition to that approach. So those are the two basic. I think the decentralized approach, where I might choose an app and you might choose an app, is a fine assistance to what we're talking about. It's a little bit like apps that determine if are you in the vicinity of a friend, and it alerts you and says, oh, somebody who's on your list of friends is just a block away, and you go, oh, I want to wander over and say hi to that person. I mean, that basic sense of connection and information. But that's my summary: is the decentralized voluntary system is a fine complement. I'm comfortable with that, but it's not going to solve the problem. We've got to have the social worker individual who goes out and talks to people effectively and works with them.
Awesome.
Yeah, just wanted to second that. I mean, I think there's just, there's these two strategies of apps, and, the voluntary one is probably just not going to be comprehensive. We've seen it tried in other countries, and, maximum maybe 10, 20% of people actually participate. That's not comprehensive. And the centralized one has problems. And none of these apps really have been road tested. I think, we have a kind of, some people call it a solutionist culture, right? We'll just throw a little bit of technology at a problem. But, given the conversation we've been having, I think you can see, that apps and technology can play a role assisting us. Absolutely. And we should design them to assist us in this project of contact tracing and social support. But an app isn't going to be able to find out whether you need help getting groceries for your kids. I mean, it's not going to solve all the kinds of problems. It's not the wraparound care that we really need. At best, it is going to, I think, give us some information that then we really need human beings who are going to help put together the package of care that people need.
Thank you, Amy. Gregg, you recently said, I don't know if this is quoting you exactly, but I think you said the federal response to coronavirus has been slightly less than catastrophically awful. My question to each of you before we wrap up is a message of hope. Do you have any words of wisdom or a message of hope as people go into this long weekend?
So we've done something extraordinary across the country. We flattened the curve because ordinary Americans have cared enough about their neighbors to shelter in place, to wear masks, to keep visits outside to a minimum. That's an enormous act of generosity and solidarity that we should all be proud of. And that's how we're going to get out of this, right? And part of that solidarity and generosity is getting on the phone to your senators this weekend too, because you're not just sticking up for yourself, you're sticking up for your neighbors from coast to coast, north to south, east to west.
Yeah, I agree with that. What we do really matters. And we have seen this incredible surge of kind of solidarity and support. And, we got to sustain that. We got to keep at it. And we got to turn that also into a claim to get the kind of support that we need from Washington to be able to continue this over the longer term, because it really is coming out of the care that we have for one another. That has been really powerful. And I know we've all seen it in our own lives, and how wonderful our communities can be in an emergency. It's really, really moving. And now we need to step in and make sure that the structural support is there to really fulfill that potential.
We've had over 600,000 pieces of personal protective equipment donated by our community. A local group called Crafters Against COVID-19 have made masks. People from all across the county coming together, showing solidarity, staying home, helping people save lives. It's heartwarming.
When I think about Oregon, Oregon has not had, it's had deaths, but if you look at demographically, more deaths than in an average year, the answer is no. Perhaps offset by other diseases that have not been as prevalent because of the separation, perhaps less auto traffic travel. So people have really worked hard to keep this from being a complete healthcare disaster, but it is absolutely an economic implosion. The spirit of the community, if partnered with federal resources, will really take us through the next phase of this, of getting ahead of the disease. We've seen the spirit in place. The resources have been passed through the House, so that's very promising. Let's complete that picture and go forward without the partisanship, as one nation working together to address a major economic and healthcare challenge.
Amen. I think that's a perfect way to end. You guys are great. Thank you for sticking up and fighting for, the most vulnerable and really, really making sure we all understand that we're not going to get through this without community, both support and standing up and really coming together to fight for what we know all of us deserve. And for all of our viewers, everyone on this panel is working this weekend. So, they're not taking breaks off for you. So appreciate you all. Please be safe, and we'll see you on the briefing next Tuesday. I'm John, and have a great and safe weekend.